Okay, so in this video we'll take a look at the musculocutaneous nerve, which is the main nerve of the muscles of the front of arm, that is the biceps, brachialis and coracobrachialis, right? So let's take a look at its origin, course, relations and its terminations. So it arises from the as a branch from the lateral cord of brachial plexus. When we saw the brachial plexus, we talked about this nerve there as well. So after its origin from the brachial plexus in the axilla, it accompanies the third part of axillary artery, and then it pierces the coracobrachialis muscle to enter the arm region, right? So it is coming from the axilla and then in the arm region by piercing the coracobrachialis muscle, and its relations are such that it will be moving between the biceps brachii superficially and brachialis muscle, you can say below it or as a deep relation to it, right? So it will be terminating at the lateral border of the elbow joint or the lateral border of the forearm region to become the lateral cutaneous nerve of forearm, right? So it continues as it does not terminate at all. It just continues in the forearm as the lateral cutaneous nerve of forearm, and it supplies the skin in the forearm region on the lateral aspect, and it does not supply any muscle there. It only supplies the muscles in the arm region. So there are some cutaneous branches of a nerve and there are some muscular branches of a nerve. So the muscular branches of this nerve are only in the arm region, while the cutaneous branch to the lateral aspect of the forearm is given in the is its continuation actually is in the forearm region, right? So let's take a look about its relation. So when it's in the axilla, when it is just you can say arising from the lateral cord, वहाँ पे इसके relations कुछ ऐसे होते हैं that anteriorly we have the pec major as expected, posteriorly we have the subscapularis, medially we have the axillary artery, the third part of axillary artery, right? And laterally we have the coracobrachialis muscle, जिसको इसने बाद में pierce करके arm region में entry लेनी है. And then once in the arm region, it will be having its relations such that it will be passing superficially to the brachialis and deeper to the biceps brachii. So that's quite easier. Then we talk about the various branches. Okay, as you can see, it will be entering the arm region, piercing the coracobrachialis muscle, and once in the arm region, it will be passing above the brachialis and deeper to the biceps brachii muscle. तो इसके relations कुछ ऐसे होते हैं, और इसके immediately बड़ी होती है third part of auxiliary artery, laterally होता है इसके coracobrachialis, as you can see, right? So then we have its various branches. So since it is passing through the muscles of the arm region, it will be supplying or giving some muscular branches to these muscles as well, right? So the muscular branches of this muscle are to brachialis, the coracobrachialis and biceps brachii. Then we have some of its cutaneous branches, but not in the arm region, rather in the forearm region, when it continues as the lateral cutaneous nerve of forearm, just 2 centimeter above the elbow joint, right? And then it also has some articular branches or the branches to the joints, such that the elbow joint is having a supply of the musculocutaneous nerve via its branch to brachialis, and the shoulder joint is having a separate branch from this nerve, the musculocutaneous nerve, as an articular branch. Okay, shoulder joint को भी supply करती है. And then every nerve can communicate with other nerves through various communicating branches. So the musculocutaneous nerve is having a communicating branch, which is not actually a branch of this nerve, but rather a branch of the lateral cutaneous nerve of forearm, that communicates through several branches with the posterior cutaneous nerve of forearm, with the superficial branch of radial nerve, and with the palmar cutaneous branch of the median nerve. So it communicates with the median nerve, the posterior cutaneous nerve of forearm, and with the superficial branch of radial nerve, with the help of various communicating branches. So in this way, this nerve has some muscular branches in the arm, cutaneous branches in the forearm, communicating branches also in the forearm, and some articular branches to the elbow as well as to the shoulder joint. So with this note, we are done with the musculocutaneous nerve in detail. I hope it was helpful for you, and I hope that you learned about its origin, course, termination and various branches. So thank you so much. Like, share, subscribe and take care.